All right, program design, flexibility training. What is flexibility training? Why do we want to do it? What are the factors that determine flexibility? What are the benefits of flexibility training? And then how do we implement this flexibility training into our program? Well, first thing, why do we want to do it? Well, it has the potential to improve range of motion. So, range of motion is the degree to which a joint moves in a normal pain-free range. And, sometimes we have that ability, but other times we don't. So, we got to be able to work on that and hopefully improve our ability to move pain-free. So, what would be some of the factors that determine our flexibility? We have joint structure, health of soft tissue around the joint, length of antagonist muscle, temperature of tissues being stretched, viscoelastic properties of the tissue, age, sex, and physical activity history. Going to jump in a little bit more in detail of the few of these. For temperature of tissues being stretched, this jumps back to our warm-up. We got to make sure that our clients are warmed up if we're going to be stretching them or implementing any flexibility training. For age, please be aware that, as we are getting older, our joints become more resilient to bending. So the implementation of flexibility training for a aging population is important to maintaining that pain-free range of motion. And then physical activity history. Well, what we know is that being physically active generally correlates with an improved range of motion. We see that people who are sedentary do not have as great of a range of motion as those who have been physically active. That's important to understand. Maybe this is a client that's come in who hasn't really worked out before, and you see, hey, yeah, their range of motion is not really where it should be, or what's to be expected. So that could be an explanation for why. But there's definitely benefits to flexibility training. That's why we're talking about it. So what would these flexibilities be? Obviously, improve range of motion and improve performance of activities of daily living. So for improving range of motion, obviously long-term training has been shown to improve this range of motion. It's important to note that we don't really look at flexibility training as like an acute kind of improvement. You may see some improvements in short term, but they definitely don't last. So we need to be consistent with our training for flexibility in order to see long-term improvements. And then, improve performance of activities of daily living. So the ability to perform ADLs has been highly correlated with joint mobility. So as we improve that range of motion and joint mobility, we're going to be helping out our clients, with their ability to perform those activities of daily living. As I said, especially for aging populations, this becomes more and more important as we get older. So this is going right back into why it's important to have this flexibility component. But we should talk a little bit about the risks. So some risks with flexibility training. We got joint hypermobility, decreased strength, ineffective for preventing injury, and temporary effects. So joint hypermobility is characterized by extreme range of motions accompanied by mild to moderate intensity in pain. So there can be too much. We don't want to be overtraining flexibility components if somebody already has a healthy amount of flexibility and joint mobility, because it could become, could end up having negative effects if we continue to push them beyond what's normal. Decreased strength with static stretching may acutely reduce muscle strength and endurance performance. So we'll get a little bit more into the types of stretching, but for right now, we don't want to have our clients perform any static stretching before. We're really trying to optimize their muscular training, strength training, and endurance training, because it can reduce the overall performance. Ineffective for preventing injury. Well, improving flexibility does not necessarily prevent musculotendinous injury. There's nothing really to say that just because you're stretching it prevents injury, but properly implemented flexibility training can overall improve, activity, but there's never any guarantee, right? No guarantee of preventing injury. So make sure we're not saying these things. And then last one, temporary effects. So increased flexibility has an acute effect, but long-term training is effective for increasing flexibility. So I kind of already talked about this. We're looking for the long-term effects, right? So we want to see an improved flexibility outside of like this training, right? So you can train somebody and say, oh yeah, look, we have increased flexibility from what we just did in this training session, but we're trying to see over time if that improves their range of motion without having to do, this flexibility training. Are we actually getting this chronic adaptation of improved range of motion? All right. So that all being said, let's talk a little bit about the frequency, intensity, time, tempo, volume, and progression. So frequency, we want to incorporate flexibility training at least 2-3 days per week for a client that needs to improve range of motion. Daily flexibility is most effective. So the more you practice, the more of a benefit you will get out of it, right? So if we can convince our talk to our clients about, the importance of daily flexibility training, and we can have them, at least practice some of it each day, then we'll see the benefits of that improved range of motion sooner than we would if we were just to meet, those 2-3 days per week. For intensity, just keep in mind you should not create discomfort or pain. So we're trying to work within that pain-free range of motion. All right, never pushing beyond that. We don't want to hurt our clients. Yeah, it's pretty simple. For time, 4 repetitions per stretch. So it's pretty simple, right? So if we're, say, doing a pectoralis major stretch, then just make sure we're doing 4 repetitions per stretch, maybe per side. But yeah, pretty simple. Type. Here we go. So let's get into types. So we got static, dynamic, proprioceptive neuromuscular facilitation, and ballistic. I'll talk a little bit about those. So static stretching can be performed actively or passively. These stretches are slow movement and holding into position for 10 to 30 seconds at peak tension. Your goal with these are to accumulate to a total of 60 seconds. So, if we're doing 4 repetitions per stretch, then you can break that into like 15-second holds, right? And then you do that 4 times and you'll accumulate to that 60 seconds, all right? So the really important part of the just static is that you're holding at that peak tension, right? So all the way out, you're holding it and then you're bringing it back in, okay? Dynamic. So this is movement along with muscle tension. So this is, you're moving in and out. Begin with gradually small range of motion, progressively increasing to a larger range of motion. You're going to repeat these 5 to 12 times. All right. So dynamic stretching, or their movements, can be very similar to the static stretching, except you're just not holding out at the end and you're not aiming to go to that peak tension, right? So you're starting out with a small range of motion and you're progressing to a larger range of motion as you make your way through your repetitions. As I said, you're trying to do about 5 to 12 times per stretch. Dynamic stretching is definitely more appropriate for, warm-ups and pre-activity flexibility training, right? Proprioceptive neuromuscular facilitation, or PNF. Well, this involves both active and passive techniques. So isometric contraction is followed by a static stretch in the same muscles tendon group. It's just kind of a contract relax mechanism. PNF should only really be incorporated if you know what you're doing, because it does require more of a manual manipulation. So you'll really have to be more hands-on with your client. All right. We'll talk more about PNF on another presentation, just because it is a really interesting flexibility training. And ballistic stretching. So ballistic stretching is an approach that involves a bouncing or jerky type movement to reach the muscle's range of motion limits. Where would this be appropriate to use? Well, it's not really appropriate for the general population, but it may be suitable for athletes involved in ballistic sport skills. So we're not really going to be using ballistic stretching in most cases, all right? But maybe for athletic trainers with working with athletes where explosive movements are critical. Okay. So, in general, we stick with static and dynamic stretching, but we can cover the other ones in greater detail to kind of make sure we're practicing them safely. As always, only implement things that you're comfortable and have a true understanding of how to perform, so that we really limit the risks that we put on our clients. Okay. So volume, same thing, right? So depending on what kind of stretch you're doing, you will either be doing, an accumulation of 60 seconds, 5 to 12 repetitions for proprioceptive neuromuscular facilitation. You're just doing it for, 4 repetitions per side. In ballistic, it's very similar to dynamic. You can do it for like 5 to 12 repetitions. Progression, we don't really have progression for flexibility training, but what we know is that obviously your progression is going to be based off of how much improved range of motion you have as a result of your the flexibility training. So your progression is based off of the range of motion, right? So as we improve range of motion, obviously we want to just get them back to normal. And once they're normal, just kind of maintaining. We're not trying to train them into greater range of motion to possibly create joint hypermobility. We're not aiming to get there. But yeah, so that's flexibility training. That's what you need to know. There it is. Implement that into your training programs and let me know if you have any questions. Thanks for listening.